Well, thank you for having me. Pretty excited to talk about this. I will be sharing some of my dissertation research that I did last year and kind of talking about what I'm doing with that moving forward as I'm working with teachers. So I pulled up some pictures to get you kind of in the mindset of thinking about what stress is like in your life, and maybe think about some of the teachers that you've had in your life and what stress looked like. I'm sure none of us ever had a teacher that was stressed, right? All of our teachers were calm, cool, and collected. So she's pretty stressed. 2 times feel stressed day and night. Turn around and leave quietly and no one gets hurt. This is one of my favorites. I think I've seen this on some teachers' desk before. And the poor fish in the blender. Oh. Okay, so I've got a few did you know type things about stress, because what I find is a lot of people know stress and they know it's bad, but they don't necessarily know exactly what stress can do to you. If I can go back. So your body does not know the difference between stressors. So there's a lot of different types of stressors. And if you think about the things that have caused stress in your life, there are things that can be life-threatening. So an example would be a lion starts chasing you, right? That's likely to be life-threatening. What about an imagined stress? Can somebody give me an example of that?
Deadlines. Imagined stress.
Okay.
Totally imaginary stress.
So what type of stress would you imagine related to a deadline?
No life after this.
No life after,
yeah.
yeah? Okay, so what happens if you don't meet the deadline? You start making up these things, all these scenarios in your head. A really great example is in relationships. So a lot of time, we have this instant gratification thing with cell phones and text messaging, instant messaging. So what happens when whoever you message does not respond to the message in what you feel is the appropriate window of time? What do we start doing? Worry. We start, well, are they mad at me? What did I say? Maybe they got in a car wreck. So you start making up these scenarios, and none of which are actually usually based in reality. So we actually make up things to be stressed about. And some things are just minor annoyances, like that student talking in the back of the room when you're teaching. It's not exactly life-threatening, and you're actually choosing to let that bother you. Chronic stress has many negative impacts. We'll actually get into those. So people who show chronic unmanaged stress are as much as 6 times more predictive of cancer and heart disease than cigarette smoking, blood pressure, and cholesterol level. And it's also much more responsive to intervention. You don't actually have to go on medications. Huh?
You didn't say lung cancer, but heart attack.
Yeah.
So like cigarette smoking.
Yeah. So over 1/2 of the cases of heart disease cannot be explained by the common risk factors, such as high cholesterol, smoking, or sedentary lifestyle. So a lot of researchers are starting to think that the link is maybe the stress and not so much those, because every day we have people that seem perfectly healthy falling over dead from.
Well, and we try to hide stress, don't we?
Oh yeah.
So the symptom. How do you know that a person is stressed?
We try to hide it, but we also live in a stress-positive culture. So what conversation do people usually have around stress?
So busy.
I'm so busy. Oh, I'm so stressed right now. So it's kind of become to be this badge of honor that we wear, that we are so stressed. Instead of talking about how great we are at managing our stress, we talk about how stressed we are, and as if it's a positive thing to be that stressed. And it's not really a positive thing to be that stressed. People who are unable to effectively manage stress had a 40% higher death rate from cancer than non-stressed people. pretty powerful. Yeah. I always throw up the example of Joe Paterno. So what happened with him? Did anybody follow the sequence of events?
Right. Did he have cancer at the time that all of that stuff was happening?
He
around
had
Penn
not been
State?
diagnosed. So we had
Really?
the big Penn State scandal.
Yeah.
And then he was diagnosed with cancer, and within a matter of months he had died.
Yeah.
So
Now, he was an old guy though, right?
he was older.
Old.
But it doesn't matter what age you are, if you add stress to the mix of cancer, your survival rate is going to be lower, because when your body is busy working with that stress response and your organs are busy dealing with that stress response, it doesn't have the resources to deal with those cancer cells like it normally would and to deal with recovery. So there was a study that was done. There was a study that was done in the UK, and there was a 2-year period when people learned that there were going to be major layoffs, and so they were followed for those 2 years. And what they found was that there was a 150% increase in visits to the family doctor, 70% increase in episodes of illness, 160% increase in the number of referrals to hospital outpatient, and 200% increase in the number of attendances to outpatient departments. So it's pretty significant. And that was just a psychological threat. There was no real, actual, like, you are going to be fired tomorrow. It was the possibility that within 2 years, you might lose your job. Stress can also impact offspring when a pregnant mother is stressed. There's been several different studies done. We find increased cardiovascular disease and cholesterol issues in the offspring, increased responsiveness to stress, and issues with emotional regulation. So have a hard time dealing with that anger when it might be elicited, or sadness. And a more recent study has found a trigger in neurons that can activate schizophrenia, autism, and PTSD in the offspring when a mother is exposed to extreme stress while she's pregnant. When we look at the population of teachers, what are they the majority? Female or male? Yeah, so this kind of thing is very impactful to teachers. Stress and anxiety are contagious. This was pretty mind-blowing for me when I started learning about this.
Up to 4 feet?
Up to 4 feet. So if you think about the setting we're in right now, could somebody's stress be contagious? I think we're all within about 4 feet of somebody.
So if I'm like all stressed out here, I could be affecting. I could be affecting Abigail, but not Bree. Bree's immune.
Well, it might take a little longer for it to
it
get
has
to her.
Go around.
Yeah. So if everybody picks it up, it could domino effect all the way to her.
Well, and in a classroom too. I mean, if there's a stressful situation, say with the student, of course it permeates the room.
Mm-hmm. Yeah, and in my dissertation, what I did was, and I also did a pilot study, is I put heart rate monitors on pre-service teachers when they were doing their micro-teachings in a lab setting.
Uh-huh.
And I actually sat in the classroom when they were doing their teaching. And the ones that I found to be high stress, so I couldn't see their stress readings real time, it was afterwards. But I was taking notes of what I was observing in the classroom, and you could feel the tension in the room with those high stress teachers. And the students reacted differently to them.
Uh-huh.
And it very quickly spread across the room.
And is heart rate the measure of stress?
There's several. You can do galvanic skin response, but that kind of gets a little weird because the left side of your body and the right side of your body respond differently, and that works with the electricity in your skin and sweating. And they've got wrist or finger devices for that. You can do cortisol, but cortisol is kind of an over time measure. With the heart rate monitor, I can actually go down to a 5-minute segment of time to look at stress levels.
Okay. And then, I don't understand the cortisol. Are you what are you measuring with the cortisol?
you're measuring increased cortisol is increased stress.
And how do you measure that on,
You can do-
on the fly?
You have to do a cheek swab usually,
Oh, okay.
saliva.
Stop teaching.
You can do urine samples or saliva.
Either way, it'd be very
Yeah, it's like,
entertaining.
hold that thought, let me come swab your cheek there. Yeah. So the heart rate monitor, and this is the monitor, this is a newer version of the monitor I actually used. So you wear it right here, and then this would hook to a electrode on the rib. So they can wear it, they wear it underneath their clothes. Most people don't even know they're wearing it. Okay, so the thing about the communicative stress is that it's your heart and it's the electromagnetic stuff that's happening with your heart that eventually transmits. And they've found, especially if you're touching somebody, it really passes that stress. So shaken baby syndrome, a baby's upset, we go pick it up. Does the baby calm down immediately? No. So what frame of mind is the adult that picked up the baby usually in?
They're stressed.
They're stressed. So they're holding that baby now, communicating that stress to the baby. Then the baby elevates, and then that feedback to the adult, and you just keep this feedback loop going until both of them are out of their minds because of the increased stress.
But it also works to the other side.
Yeah, you can calm. Yeah, you can also calm. So anytime I'm working with students and they're very anxious, I oftentimes will stop them and I'm like, okay, I need you to take a breath. Take 3 deep breaths for me. And I've actually stopped pre-service teachers while they were giving a lesson and said, I need you to breathe. So they do their 3 deep breaths and then they're like, okay. And they're almost a totally different person after I have them just take 3 deep breaths. Because they get to where they can't even come up with the right word, and they're stuttering and they're tripping, and they start sweating. So you can get them to calm down a little bit. Okay, so what do classroom management, job satisfaction, and teacher stress have in common? And I'll present you with some of my data from my dissertation, but this is kind of the question I want you to be thinking about for when we have some discussion time. So the daily activities of the classroom have an overall greater effect on stress than significant life events. So it's that daily grind that seems to bother teachers and anyone in any position more than that big significant life event. Maybe it's a relationship ending or a death in the family. Those have an effect, but the greater effect is the daily things. Stressed out teachers, they show more instances of inappropriate behaviors, such as yelling at students, cognitive misfunctions, an example would be incorrectly marking a test, lack of social functioning, so those pro-social behaviors, that charisma, warmth, involvement, you just don't see that in teachers who are stressed. And I think we can all think of somebody who fits that bill. I always think of the math teacher who was across the hallway from me, who was just an incredibly negative person, but she never smiled, and she never said a kind word to anyone. In fact, I was taking students on a trip, and she comes over, and she's like, I can't believe you're taking Zach on this trip. I was like, okay, I'm sorry. Be glad he's not in your class today, I guess. And I think we can see that these behaviors definitely compromise the quality of education. So how stress works is you have a stressful event. We use our senses to appraise and determine whether it's a real or imagined threat. We determine how we view that threat, and then the stress response is activated. So that's our fight or flight that we talk about. And what that is you have this HPA axis, and I won't go into all this because I'd rather spend time on other things. But the big thing I do want you to understand is the difference between the sympathetic and the parasympathetic. So you can think about the sympathetic like the gas in a car. So you push on that gas pedal and it's go, go, go. So that's that fight or flight. You need to do something. And what does that feel like when that's activated? Anybody throw something out there? Think about, for me, it's when I'm driving down the road, and all of a sudden, there's a police car behind me, and the lights flash on. What happens in your body? What feelings do you notice?
Your stomach drops.
Your stomach drops, tense. You got that iron grip. I actually threw my cell phone across the car one time. I was on the phone with my stepmom, and I saw a cop car, and I was like, whew. She was like, what happened? And I had her on speaker, so it wasn't, I don't know, that was just my instant response. What does your heart do? Starts racing, right? What starts going on in your head? What have I done? What do you start checking your speedometer? Oh, am I going fast? Did I blow through a stop sign? What's going on? So there's a lot happening. But then the important part is the parasympathetic response, and that's the brakes. So that's going to slow down that fight or flight response, because that fight or flight response is not a good place to be in for long periods of time. The front part of your brain actually shuts down. What does the front part of your brain, that prefrontal cortex, do? Decision making, ethical reasoning, higher order thinking. So if we have people operating with that part of their brain shut down, what kind of decisions are they making? Probably not the best decisions they could have made.
These are moments where if you are, for which practice, training and such things are
Yep.
key.
Yep.
Right?
Absolutely.
What you have practiced doing in time of stress is what you turn to.
Yep. Yep. Yeah, that's where your habits kick in. Yep. Yeah.
How does this become chronic? Because I'm envisioning like a circle, but there doesn't seem to be a circle in your graph that you had on the previous slide.
Yeah, well, that's just showing the response.
Yeah.
Yeah, so what happens is you've got this happening. It puts you in a negative state of mind when that prefrontal cortex is shut down. So then you're only seeing the negative things in life, right? You ever have those days where you wake up on the wrong side of the bed and everything seems to go wrong for the rest of the day? Well, there were positive things that happened that day, I'm pretty sure, but they didn't register because it's that back part of your brain, that caveman brain that we talk about, that's activated. So it does become a cycle, and I think you'll see that a little more.
Yeah.
And the big thing about the sympathetic versus the parasympathetic is sympathetic is involuntary. You can't stop it from happening, but the parasympathetic can be voluntary, where you can initiate those breaks. So it becomes up to you whether you're going to let that sympathetic response go or if you're going to stop that cycle. So chronic sympathetic activation can cause problems with concentration, making decisions, memory, fatigue, lack of energy, lack of motivation, frequent illness, and sleep disturbance. The difference between acute stress and chronic stress is acute is just isolated incidents, whereas chronic is happening over and over again. And that chronic stress, you've got a lot of not so good health outcomes with that chronic stress. So I taught high school for 5 years, and then I started graduate school to work on my PhD. My second semester of graduate school, I got onto the stress management biofeedback thing. Before that point, I was on blood pressure medications at the age of 27. Since I've worked in stress management into my life, I've been able to get off of them. I used to have headaches almost daily. Taking naps was about the only way that I could get relief, and I didn't realize that that's what I was doing, is naps was the only time that my sympathetic system was not going. So chronic stress, eventually, if it lasts long enough, can cause neurotransmitters to burn out. So you're actually making yourself dumber by being stressed all the time. And neuron death, depletion, and malfunction. We kind of talked about all this stuff a little. Right? People are like, your presentation on stress is stressing me out. So we kind of talked about real versus imagined stress already. And I have to work with my pre-service teachers quite a bit about that because they're very critical. and they have a hard time seeing what they did well. And that's a problem, because if you only see what you did wrong, you're not paying attention to what the positives are to make sure you keep doing those. And it's also important just for overall regenerative effects so that you're not burning yourself out. Oftentimes, especially with our new professionals, they'll be comparing themselves to this person who's been teaching for 12 years and is a master teacher. And so comparing yourself to an ideal is not always beneficial when you're a novice. Denial and avoidance. I did a lot of happy hours when I was teaching. A lot. With other teachers. We did a lot of happy hours. Okay, so Ashley has some handouts so you can see this data a little better. This is from the round of data collection I did last year. I had 8 pre-service teachers, and I put heart rate monitors on them. And what the numbers are at the bottom, so if you look at the bottom axis, the 35.1, 0.2, and 0.3 are the time surrounding when they actually did the micro-teaching lessons. So they did the lessons for 35 minutes in the class that they were in. The 35.1 is the 35 minutes before the lesson, 35.2 is during the lesson, and 35.3 is after the lesson. The 5.1, 2, 3, those are the 5-minute segments during the lesson. So that's the lesson broken down. And then the 1.1 through 6 are the hourly breakdown through the entire day that they wore the heart rate monitor. Each teacher wore it for 2 days. The lessons were a few weeks apart. It's a peer teaching type system, so they're teaching to their peers. When I took all the data and analyzed it, what I found was that the teachers easily fell into 3 different groups. And that's what you see here are the low, medium, and high stress profiles. If you see on the low stress profile, there's actually a negative 0.1 at the 1.2 mark. And what that means is that their parasympathetic system was more activated than their sympathetic. So they were in recovery. So what do you notice when you compare the low stress to the high stress people?
Tell me what the y-axis is again?
Oh, sorry, the y-axis is their stress level. It is the log of the low frequency to the high frequency heart rate variability.
Okay.
Yeah,
okay.
so it's the ratio of sympathetic to parasympathetic activation. So a higher number means that their sympathetic system was higher. And a higher number is higher stress. So my high stress people, were they ever in recovery? No. And these are all normalized, so each individual person's baseline was accounted for in these. And the total number is for the entire day that they were wearing the heart rate monitor. So let you kind of think about that as we go into the qualitative portion, because it was a mixed method study. So after I observed their lesson, I brought them in for an interview, and I had already analyzed their heart rate data, and so I knew where their high and lows were during their lesson. And I asked them questions related to that. And I would actually ask them to tell me when their highest stress time was and when their lowest. What do you guys think I found? Yeah?
If I had to guess, I would say the low stress person and maybe the medium stress person would be very aware of when they were most stressed and least stressed. But the high stress person really wouldn't have any idea because they were high stressed all day, so it would have been just a random moment they may take instead of low stress.
Yep, absolutely. My medium stress didn't really have a good idea of what their stress levels were even. My low stress people were pretty spot on. They could tell me when their stress got high, and they could also tell me what high stress felt like to them. They could very accurately describe those low and high stress times for them. High stress was just totally out of touch. So the first theme I found was that when they're not able to live in the present, they're going to be more stressed. So what this meant was they would be up in the front of the room, and here's a quote from one of them. "In my head, I kept saying, this is not going well. Why can't I keep a straight face? What is going on? I need to stop this. Why can't this be over? Has it been 5 minutes yet?" I mean, and she said it faster than I said it. And I was just like, whoa, that's a lot of stuff happening there. So they were worrying about all these different things instead of just being in the moment. And where this really played out is as I was watching them in the classroom, when a student would ask a very relevant question or offer a very relevant comment, the low stress teachers would be like, "Oh, that's great." And they would go into more detail about how it relates to what they're talking about. Or they would try to steer it back to, "I kind of get what you're saying." The high stress teachers would, I was sometimes wondering if I was imagining things. Like if I was imagining the students making comments because they didn't even bat an eye. They acted like the student had said nothing. So the high stress teachers viewed those students' interjections as impeding their path toward completing this lesson, rather than adding to the lesson, because they were so worried about the end that they couldn't be here with what was happening now. So the second one was that stress cognizance and impact on the learning environment varied according to their profile. So the low teachers, as we kind of talked about, they were in tune to what those stress levels were like, and they would actually plan to accommodate that. So they kind of knew when that stress was going to happen, and they would plan for it. Or when things could reach a hiccup in the classroom. The medium teachers, they described the symptoms, but they often would say, "But it's not because of stress." They would actually tell me that. So they would say things like, "Oh, I sweat a lot and my face turns red, but that's just how I am." Well, those are pretty telltale symptoms of high stress and high blood pressure because of high stress. So they would say, "It's natural and normal for me. I can function on high stress." So they think it's a benefit and it's part of that conversation that we have all the time that stress is helpful. The high stress people, one of them has already failed physicals at the age of 22 for blood pressure. And they would have to take melatonin and prescription sleep aids to sleep at night, which stress causes major interruptions in sleep patterns, because when we lay down to sleep, there's nothing else to occupy our minds, so we really start churning. And cortisol, which is increased because of stress, has about a 12-hour shelf life in our body. So a lot of times, the accumulation of the day, we've got pretty high cortisol levels by the time we go to sleep.
I have a question that is, I think, out of the realm of what your research is, but does it seem to you that teachers have normally high proportion of high stress people? I mean, I'm thinking like, okay, if going into the classroom or preparing for the classroom, being in the classroom is a stressful thing for you, have you just chosen the wrong space to be, or is it just that people who are stressed are distributed across different professions and awareness of stressfulness of your level of stress isn't associated with that particular career choice?
I think teaching has a pretty unique context to present opportunities for stress, because the number of decisions teachers have to make in a given day are, I think, in the thousands, really high. And so anytime you have that kind of decision making having to happen, your likelihood of stress is going to be higher. So I work with a group called Heart Math, and they also work with military and police. We see very similar things with teachers, military, and police.
Oh, that's interesting.
One of them is blacking out. So, and I had this happen in my pilot. I had a young man teaching, and he was textbook stressed out person as I was writing notes on him. And there was a student who actually got up and left the room and went outside and was waving at us through the window. And she didn't do it sneakily. She got up, walked in front of him. He didn't even notice that she had left the room. Because he had turned to that lesson plan as he was holding that lesson plan, and that was his sole point of focus. And so becomes global awareness, goes away. And he just had no idea what was going on outside of that lesson plan. So that blacking out also happens in police and military when you have a high stress situation and you ask somebody to recall the details of what happened and they can't. And so a lot of these teachers, especially the high stress ones, when you ask them to recall how did things go and you're asking them to do reflection, they usually can't remember.
That's what happens in violent crime situations
Yep.
too. When you get, mugged by somebody with a gun, and they ask you to describe the scene later, people usually can't describe the person holding the gun, but they know exactly what the gun looked like. It's probably something related to the lion chasing me scenario, where you really don't care what that tree looks like or how big that lake is, or what
Yep.
shape this rock is. All you care about is that lion.
Yep.
And that's the
We
only
call
thing-
it tunnel vision.
Yeah.
Yeah.
Anything to the periphery just disappears. Like the other
It does.
day, I was doing a physical test and I could see the one spot in front of me, and I could hear the person that was right near that spot, but there were 5 other people around me talking to me. I had no idea. No clue. And they were like, "You did such a good job. Like, did my comments help?" And I was like, "You were there? Like, what are you talking about?"
Yeah, so I think teaching is kind of, I don't know that it draws people that are more prone to stress, but I think it
Is
presents,
one of the high stress
it's a high stress job, yeah.
I hate to compare teachers to prison guards, but you're in one of those situations where you are in charge of this classroom and you feel like you do have to keep control over it, especially
Mhm.
if you have unruly students. We have the same thing. I'm a summer camp counselor, and what you're describing is very similar to something I see in a lot
Yeah.
of camp counselors. You feel like you have to control them because something dangerous could happen if they don't listen to you and if they don't follow your instructions. And any situation where you start to feel like you're losing control will just make you get more defensive, because it's very important to you that you be in charge for whatever reason.
Oh, and teachers are control freaks,
Oh, yeah.
kind of across the board. And
Oh.
and that,
No, some of us are, but not all.
well, the majority of them seem to kind of be, and so,
Interesting thing, we are working now with teachers and they are doing something new, and we told them that they got permission not to know and not to be on control because they can't.
yeah.
And they feel that it's so less stressful now.
Mm-hmm.
They feel so good in the
Yep.
class.
Yep.
You don't feel like you can fail horribly. Like, compared to my job, if I write a program and it doesn't, work the first time around, nothing bad happens. The world doesn't end. You don't
Well, and
have
that's-
kids going home failing math tests because I, forgot to comment a line of code out or something. So it's a more stressful job.
We seem to forget that there is tomorrow. If the kids didn't get it today, there's tomorrow to do some more work if you need to. My high stress people said, I feel like if you're low stress, you just don't realize it. It's just another day. Well, if we look at my high stress people, do they recognize what low stress really is? It's not just another day for them, because a typical day for them is living in stress.
Yeah, that's kind of the scariest part of your presentation, right? You don't know. You don't know you're in the high stress group till you drop, till you fall over.
Yep.
I mean, it's like insanity.
You were the heart monitor.
Till you wear the
Yeah.
heart monitor, right?
And I did, when I did this study, after the second time when I did the second interview, I did share their results with them and talk to them about what their stress looked like and what seemed to be their triggers. And I actually had several of them come up to me months later and say, that study that you did with me helped me so much because I learned that this was a trigger for me so I could work on it. Yeah. Okay, so in the last theme was that teachers with higher stress levels were more likely to blame students for negative, unexpected outcomes. So when a lesson or an activity did not go the way they thought it was planned, high-stress teachers would actually blame the students, and the low-stress teachers would blame themselves and say, okay, I obviously did something wrong today. I didn't ask the right questions, so I need to go back and figure out how I can make this better. How can I learn from this? The medium-stress teachers, they would discuss coping with the issues, the behavior issues that they had and how things didn't go according to plan, but they would never describe specific steps to improve it. They would just notice it. They didn't actually have a plan for improvement. So that's better than not noticing at all. My high-stress teachers would say it's just the way they were that day. So they would say the kids came in and they were just out of control and crazy, and there was nothing they could do about it. So they did not view themselves as being agents of change and having any control in impacting student behavior. They would say they were rowdy. They would blame it on immaturity, whole range of things, just over and over again. They would say that same thing. So when it comes to changing and improving as a teacher, if you view the source of the problem as something beyond your control, what's the likelihood of you being able to improve that and get better? It's not very high because you don't view yourself as having control in that situation. Whereas the teachers that say, okay, I'm obviously a piece of this equation here, so something I'm doing is impacting what's happening. So what can I do to make it better? Yeah?
So on that previous slide, it seems like, so these are people who define themselves as teachers, right?
They were getting ready to go student teach.
Right.
Yeah.
So I feel like they seem almost defensive, like the medium and high stress people, like you're threatening somehow their self-worth. These students are threatening their self-worth
Yes.
because they're not behaving. But I wonder whether it would be the same kind of reaction for people who don't define themselves as teachers, like who have an alternative definition of their self outside of, if they had to do the exact same thing, but
That's a good point.
they don't define themselves as teachers.
That's a good point.
Because I feel like if you put me in a classroom and said, hey, teach these things, and it
Right.
didn't go poorly, I'd be like, yeah, I'm not good at teaching.
It's a threat to their main identity.
Right, because for
Yeah.
me, I feel like it wouldn't be such an affront to who I am, and I wouldn't feel so protective of it. So even if it went terribly, I'd be like, well, I'm not trained to be a teacher, whatever.
Yep. Absolutely. Very good point. Did you have?
No.
Okay. Okay, so in looking at all of this, increased stress awareness in lower stress teachers is likely a predecessor for their lower stress levels. So they're more in tune with their body and their physiological symptoms of stress and able to self-regulate. My low stress teachers, every single one of them exercised regularly. Not a single one of my medium or high people did. It's a small group, but an interesting thing to note. Externalizing of blame on something beyond the locus of control relieves the teacher from responsibility and control. So that's something Dweck has said also. So then we have the present-mindedness, contributing to the inability to really engage with those students. And then this last bit is kind of what I'm trying to work with in my time as a teacher, educator, and researcher to try to reform how we do teacher education to make sure this becomes a large component of what we are doing when we are training these teachers, that they learn how to identify stress and deal with it in their lives. So that's what I have.
Thank you.
Thank you.
One question. So you were looking at pre-service teachers.
Yep.
Is anyone looking at senior teachers?
I actually tried working with first-year teachers this year, and I had to terminate the study because they would not participate. So what I'm planning on doing this fall is launching a study with the pre-service teachers that are seniors and follow them for a couple of years. There's not been a whole lot of studies done with heart rate variability in teachers. Mostly it's self-report, so we give teachers a questionnaire and it's a one-time data collection. And the problem with that is people don't know when they're stressed. So they're reporting perceived stress, once. And so your perceived stress today and tomorrow could be very different things. So the stress literature that does exist on teachers is lacking for sure. But the heart rate monitors, I think I've only found one other study that's been done on teachers.
Have you tried more senior teachers or a cross-section of the
No.
school or something?
I mean,
like
this
that?
is, I'm just starting.
Just new.
Yeah.
Of course,
It's,
of course.
I do want to
But
eventually
that's
get
the
to that
direction
point.
you'd like to go.
Yeah. For me personally, looking at pre-service teachers and novice teachers is my priority, just because that's the area I have control. When it comes to professional development for teachers, there have been quite a few studies done on doing stress management with teachers, and they just don't respond to it. They don't keep up with it. It has to be a very self-driven kind of thing, like you decide that you want to do stress management and you want to incorporate that, so you seek it out yourself. So doing a study and saying, teachers, I want you to learn self-control and emotional regulation and stress management, and they're like, well, I don't have a problem with that, so why are you making me do this? Yeah.
Is taking heart rates of students in the classroom to try to measure that contagious stressfulness something that you feel like you'd be able to do? I know there's weird regulations on taking any kind of data on
So
children.
it actually has been done with students, especially around testing. So there's lots of studies out there on student anxiety and stress levels, special needs students, students with ADHD. But for some reason, the teacher piece has been missing. Yeah, so lots of stuff has been done on student stress levels.
Oh, yeah. Yeah.
Who are you sitting near in the testing setting?
Yeah, absolutely. And for some reason, some people are better communicators of stress and some people are more receivers of those signals. Not sure why that happens, but some people just have more of an ability to communicate that type of thing to other people, and others are more receivers. So we don't really know why that is as of now.
Do you think in the future you'd be interested in taking data on different types of teaching styles, like the discussion section versus the lecture versus the seminar?
Absolutely. Yeah. I think I'm going to start working with graduate students next fall, or
Ooh.
fall 2015.
They're not stressed at all.
Graduate TAs. Graduate TAs is what I'll be looking at.
I can't imagine why a graduate student would be stressed about anything ever.
I actually had one in my research methods class who used this so I could test it, because it's a new version of that heart rate monitor, and she would have been in the low stress profile. She fit very similarly to that, and she works in a lab.
You should take data on which of them are writing their thesis, because that's a very big contributing
Yeah.
factor.
Oh yeah. And that's actually how I got involved in it, was they offered these classes for graduate students at the University of Missouri where I was at, and so I started taking the stress management courses, and I was like, teachers need this. Yeah.
Anything else?
Thank you all for being here, and great questions and comments.
Thanks again.
Yeah.
Enjoy it.
Thank you.